Hello, friends. Welcome to our exciting journey into molecular orbitals. Today we are going to discuss about HOMO and LUMO in drug design. This is going to be a very important topic for understanding how drugs work at the molecular level. Now, let's dive deeper into what exactly are HOMO and LUMO. Please pay attention. HOMO stands for highest occupied molecular orbital, and LUMO stands for lowest unoccupied molecular orbital. This is very, very important for drug design. These frontier orbitals control chemical reactivity. Understand this clearly. When molecules react with each other, it's these frontier orbitals that do all the work. Now, why is this essential for drug design? When a drug molecule approaches a target protein, please listen carefully. The interaction happens through these frontier orbitals. Look at this beautiful orbital diagram. This is exactly how electrons are arranged. You can see the HOMO with electrons shown as white dots and the empty LUMO above it. Notice the phase indicators. The plus and minus signs show the quantum mechanical nature of these orbitals. Remember, this energy gap between HOMO and LUMO determines how reactive your molecule will be. This is fundamental for understanding drug behavior. Now, please listen carefully. I want to start with a simple analogy that will make everything crystal clear. Imagine a building with floors numbered by energy. This is very important to understand. Think of it like this. We have a basement which represents low energy, and we go all the way up to the penthouse which represents high energy. Now here's the key concept. Imagine you are putting balls which represent electrons on these floors, which represent orbitals. And remember, only one ball per floor, from bottom to top. So, what happens now? The highest floor that already has a ball, this becomes our HOMO. Please remember this carefully. HOMO means highest occupied molecular orbital. The next empty floor above it. This becomes our LUMO. This is crucial. LUMO means lowest unoccupied molecular orbital. And here's something very important. LUMO always sits above HOMO. It has to be higher in energy because it's the first available higher slot for an electron. Please keep this concept in your mind. It's fundamental. Now comes the exciting part. How do we actually use HOMO LUMO theory in drug design? Please understand this carefully. There are 4 key applications that are very, very important. First, reactivity prediction. The HOMO LUMO gap tells us how stable our drug molecule will be. This is crucial. We don't want our drug to be too reactive or too stable. Second, binding affinity. Please pay attention. When drug molecules bind to target proteins, it's through orbital overlap. The better the overlap between drug HOMO and protein LUMO, or drug LUMO and protein HOMO, the stronger the binding. Third, selectivity. This is very important. Different targets have different orbital energy levels, so we can design drugs that selectively bind to specific targets. Fourth, ADMET properties. Please remember, ADMET stands for absorption, distribution, metabolism, excretion, and toxicity. HOMO LUMO values help predict all these properties. Here's the golden rule. Chemical reactions occur through interaction between HOMO of one molecule and LUMO of another. Please keep this in mind always. Now let's talk about the actual numbers. This is where theory meets practice. Please listen carefully. There are 4 important parameters we calculate. First, energy gap, written as delta E. This is very simple. Delta E equals E LUMO minus E HOMO. Typical range is 3 to 8 electron volts. Second, chemical hardness, written as ETA. Please understand, ETA equals energy gap divided by 2. Remember, higher hardness means more stable molecule. Third, electronegativity, written as Chi. This is important. Chi equals E LUMO plus E HOMO, divided by 2. This tells us the electron attracting power. Fourth, electrophilicity, written as omega. Please pay attention. Omega equals Chi squared divided by 2 ETA. This measures reactivity. Here's the drug design rule. We need optimal HOMO LUMO gap that ensures good binding while maintaining stability and selectivity. This is the balance we must achieve. Look at this diagram. Please observe carefully. Unstable drugs have small gaps. Inactive drugs have large gaps, but optimal drugs have moderate gaps. This is the sweet spot we aim for. Finally, let's see how all this theory works in real drug development. Please understand this process clearly. There are four main steps in drug development where HOMO LUMO analysis is crucial. First, virtual screening. This is very powerful. We can filter thousands of compounds based on their HOMO LUMO properties before even synthesizing them. This saves enormous time and money. Second, lead optimization. Please pay attention. Once we find promising compounds, we modify their structure to achieve optimal energy gaps. This is where the real magic happens. Third, toxicity prediction. This is very important for safety. Molecules with very small HOMO LUMO gaps tend to be highly reactive and potentially toxic. We can predict this beforehand. Fourth, formulation design. Please remember, HOMO LUMO values help predict how stable our drug will be in different formulations and storage conditions. Here are some real success stories. Kinase inhibitors designed using orbital interactions, antiviral drugs with optimized HOMO LUMO gaps, and cancer therapeutics with selective binding. All these use the principles we discussed today. Imagine this. You can now predict whether a molecule will be a good drug candidate just by calculating its HOMO and LUMO energies. How amazing is that? Now let's understand how these orbitals actually create binding between drugs and targets. Please listen carefully. In drug-target interactions, two main scenarios happen. First scenario, when the drug's HOMO is higher, meaning less negative in energy, it can donate electrons to the protein's empty orbitals, like the LUMO of a cofactor or metal ion. Second scenario, when the drug's LUMO is lower, meaning more negative, it can accept electrons from protein residues that donate. This is very important. Better binding happens when there is perfect energy alignment. Please remember this. Drug HOMO aligns with target LUMO means the drug donates electrons. Drug LUMO aligns with target HOMO means the drug accepts electrons. Now comes the most practical part, the actual ideal ranges for good binding. Please note these values carefully. For HOMO energy, the ideal range is -5.5 to -6.2 electron volts. This is crucial. Molecules in this range have excellent electron donating ability. For LUMO energy, the ideal range is -2.5 to -0.5 electron volts. This range ensures good electron accepting capacity. For band gap, the ideal range is 2.5 to 4.5 electron volts. Please understand, this gap should not be too wide, otherwise the molecule becomes unreactive. These values are used by pharmaceutical companies worldwide for virtual screening and drug optimization. Remember these ranges, they will help you predict whether your molecule will have good binding affinity with biological targets. This completes our understanding of HOMO LUMO theory in drug design. Thank you, and keep learning.